Dental fear. What is dental fear, the consequences, and how you can manage the fear? Dental fear is the fearful reaction and emotional state of worry to perceiving a negative outcome from dental procedures. The sound and pressure from dental tools being used commonly trigger the fear response as pain and discomfort are being experienced. This fear is more common than you realise. It is prevalent for 10 to 25% of the adult population. Dental fear commonly presents in childhood. This can be by a negative experience directly or indirectly, learning from a parent's negative experience. The distressing experience activates our fear response of fight and flight and reinforces us to avoid the dental stimulus in the future. Individuals may have other psychological disorders that can make them more susceptible to developing a dental fear when their emotions and stress is heightened during treatment, such as other phobias, anxiety, and post-traumatic stress disorder. In research, dental fear is shown in many frameworks, but will focus on Armfield's application of the vicious cycle of dental fear. The fear is strengthened by avoidance behaviour and leads to negative consequences. For example, a symptom of a sore tooth presents, then the thought of going to the dentist and experiencing a negative outcome is fearful. This leads you on to avoiding the dentist and delaying treatment. As time goes on from dental treatment, the dental problem deteriorates and the symptoms persist. The cycle begins again with more distressing from avoiding it the first time. The problem can get worse and the dental work can be more painful, and the fear is reinforced by the pain that is being experienced. It is important to understand the consequences if we don't break the vicious cycle. Our oral hygiene is important to prevent tooth decay, cavities, and losing teeth. It is important to identify these early to prevent experiencing major dental work that can be more painful and result in loss of teeth. Tooth loss is shown to be emotionally distressing as a reduction of smiling affects our quality of life, eating, and self-esteem. Managing the fear can be addressed by engaging in self-regulating techniques, regular dental visits, and therapies. The therapies strongly suggested are cognitive behaviour therapy, exposure therapy, and dielectric behaviour therapy. These therapeutic methods vary in styles and goal directions, but they are to teach you to remain calm in a fearful situation and control your emotions under the stressful state and desensitize the fearful stimulus. To conclude, it is important to break the vicious cycle sooner rather than later and maintain your oral hygiene. If you do find yourself or others experiencing dental fear, it is important to seek out support and services to assist in managing the fear. Thank you.
Created using Powtoon.